Our presentation is on Acceptance and Commitment Therapy, ACT,
which is being brought to you by Kathy Cook,
Nancy Dootson,
Cody Russell,
and Denise Espinoza.
Acceptance and Commitment Therapy, ACT, is a behavioral therapy based on mindfulness principles which was created in 1986 by Steve Hayes. Unlike other mindfulness-based behavioral therapies, ACT is not a manualized treatment approach, but rather it is rooted in a theoretical framework called relational frame theory that focuses on human language and cognition. ACT is diametrically opposed to the medical model of psychotherapy and mental illness. From its unique theoretical perspective, ACT seeks to change the way that we conceptualize our symptoms or suffering as merely temporary cognitions or private experiences, which might be uncomfortable and unpleasant, but do not have to define our lives. Through a variety of techniques, ACT helps people learn to accept unwanted private experiences as natural, out of their control, and then commit to actively living their lives in accordance with their values. ACT is not interested in symptom reduction as a goal, but rather a transformation of the relationship between our thoughts and our feelings. ACT understands and accepts that suffering is a part of the human experience. The theory, relational frame theory, or RFT, at its core is the idea that human language has evolved out of necessity to help us problem solve. This verbal communication is dependent upon the meanings we attribute to words, which is constantly evolving and is contextual, which RFT refers to as relational responding. If I tell you that A is equal to B and B is equal to C, you are then able to determine that A is equal to C. These events, A, B, and C, are an example of a relational frame. Relational frames have three defining properties: mutual entailment, combinatorial entailment, and transformation of stimulus function. Mutual entailment means we are able to understand something about both events by the relationship between them and the context. So if A is less than B, then we automatically know that B is greater than A. This is an example of the mutual entailment between the two events, A and B. Combinatorial entailments refer to the relationships between three or more events. So if A is larger than B and B is larger than C, we then know that A is larger than C and that C is less than both B and A. Number 3, the transformation of stimulus functions is essentially the psychological content that we attribute to the events A, B, and C. For instance, if A is greater than B and A is anxiety-producing, then B is less anxiety-producing than A. So why does this matter for social workers? Number 1, the self-thoughts that we and our clients have are normal, natural, and a product of how our brain uses language to process and problem-solve situations. Number 2, rather than focusing on trying to control or avoid our thoughts, the focus should be on the meaning that we ascribe to these cognitions. Number 3, much of human suffering is a result of our attempts to avoid, ignore, or distance ourselves from our own negative thoughts, which generally increases human suffering. Number 4, ACT reduces symptoms and suffering, but this is not the goal. It is a byproduct. As clients begin to live their lives in harmony with their values through mindfulness and other ACT techniques, they learn to their suffering reduces. Number 5, the goal of ACT is to help clients learn to live a valued, meaningful life, even in the face of their pain.
So ACT has 6 core principles. Number 1, cognitive diffusion. Thoughts are a brain function, mental focus, not a literal evaluation of worth. An exercise. Talk about your thoughts as if you are watching them. Number 2, acceptance. Stop efforts to control variable levels of distress through private experiences. Thoughts are like leaves floating down a stream. Thoughts are always present, but they are harmless. 3, contact with the present moment, not non-judgmental awareness of the physical environment. Observe the present moment with acceptance. 4, the observing self in context. identify that there is a universal self outside the realm of behavioral and private experiences. Who is one watching your thoughts? You exist outside thoughts and experience. Number 5, values. Chosen qualities that shape individuals' life. They form clients' committed action. Example, log what is most important in your life. Number 6, committed action. Make plans, recognizing obstacles and setting concrete goals that are influenced by your values.
There are many techniques and exercises used in acceptance and commitment therapy. These techniques are used to develop psychological flexibility and to better understand the context of thought. For example, metaphors are a way to describe experiences from a new perspective. For example, if a client is struggling with anxiety or an issue, it may remind you of someone drowning in quicksand. And what happens if you resist and struggle, and what happens if you relax and look for other alternatives. Another example would be demons in the closet. We desire to get rid of negative thoughts and feelings and label them as demons to avoid and push them away. We stick them in a closet. Well, what happens if we open the door and let them out? Is it possible to move forward with demons running around? Written assignments. This is another example used to document and explore thoughts, feelings, and values that can be used to create new goals and behaviors. Exercises would include writing down your thoughts before and after you complete an undesired behavior, such as drinking or smoking. What's going on? And also, what is your values? How can you move towards your values while accepting the thoughts that you want to avoid? Creative hopelessness is a technique where you create space between thoughts and behaviors so that new ideas and alternatives may be explored. Understand and accept that pain is unavoidable and normal. Examine what you are attending to and what's missing from your focus. Come up with new ways to accept thoughts and feelings and move forward towards value-driven behavior rather than thought-directed behavior. Acceptance techniques, moving past the tendency to avoid or resist inner experiences that are disturbing. This is called unhooking from thoughts and feelings and focusing on behavior that is value-driven. This can be done by direct exposure in vivo or practicing in session. An example might be agoraphobia and making the challenge of going to the store while watching and accepting disturbing thoughts. Mindfulness exercises. It's focusing on the here and now, and this can be done with food, environment, all the senses, taking one out of context of thought and into the realm of current experience. Cognitive diffusion exercises. These exercises create a distance between thought and reality. The goal is to diffuse and deliteralize thoughts as they emerge. An example would be talking to your thoughts, identifying your thoughts as a person, singing to your thoughts, welcoming your thoughts. And lastly, the universal self is that place inside our mind that's always watching other activity. An exercise would be to identify thoughts and ask who is watching those thoughts. The universal self is a sanctuary of the mind. It's part of the consciousness that has no age, no time frame, and no cares. An important aspect of ACT is becoming in tune with the universal self.
So, ACT is an evidence-based program for numerous mental illnesses, including depression, OCD, occupational stress, chronic pain, anxiety, PTSD, anorexia, substance abuse, and schizophrenia. ACT has been used with adults and children, and although there are special considerations and techniques for using ACT with children, it has proven beneficial. Most research on ACT has been limited to case studies and not large random controlled trials with diverse populations. Some case studies have found that ACT appears to be beneficial for helping improve parenting skills of some rigid, domineering parents. Another case study indicates ACT has been effective at improving the quality of life and reducing stress for the parents of autistic children. There is a need for continued research on the effectiveness of ACT with diverse populations and cultures. Most importantly, there needs to be a focus on developing assessment measures that accurately measure the acceptance and values components of ACT, which are its intended purpose, and not just an assessment of client symptoms pre- and post-intervention. While client symptoms continue to be the gold standard by which we evaluate the effectiveness of evidence-based programs, a thorough assessment of ACT must also include an evaluation of how clients learn to incorporate the core ACT principles into their lives. The goal of ACT, again, is not symptom reduction, so assessment of ACT should include an evaluation of acceptance and commitment, which are the true goals of ACT.
In the spirit of ACT, we thought it would be nice to close with a poem entitled Peace. Peace. It does not mean to be in a place where there is no noise, trouble, or hard work. It means to be in the midst of all those things and still be calm in your heart. And that's the conclusion of our presentation. Thank you very much.